every 40 seconds. Someone in America has a heart attack every single 40 seconds. And here is the part that should frighten every person watching this right now. Almost half of all heart attacks are completely silent. No dramatic chest pain, no collapse, nothing that looks like what you see in the movies. Instead, they disguise themselves as indigestion, as tiredness, as a pulled muscle, as getting older. And by the time most seniors over 60 find out they have serious heart disease, the damage is already done. Today, I am going to show you 9 warning signs that your heart is already in serious danger. Signs that are happening inside your body right now that almost every senior ignores every single day. By the end of this video, you will know exactly what to look for in yourself and in the people you love. And stay with me all the way to sign number 6, because it is something your doctor checks at every single annual visit, but almost never explains what it really means when it is abnormal. And it is the single biggest predictor of a heart attack that most seniors do not understand. If you watched our previous videos on kidney warning signs and the 7 foods destroying your liver, make sure you watch this one too, because the heart, kidneys, and liver are deeply connected. What damages one almost always damages the others. Let us start with sign number 1. Sign number 1, chest pressure or discomfort that feels like indigestion. Sign number 1 is chest pressure or a heavy squeezing feeling that most seniors mistake for indigestion or heartburn. Here is the critical difference you must understand. Heart-related chest discomfort does not usually feel like sharp stabbing pain. It feels like pressure, like something heavy sitting on your chest, like a tight band squeezing around your ribs. It can feel exactly like bad heartburn, which is precisely why millions of seniors take an antacid and wait for it to pass. The rule doctors use is this: if you take an antacid and the discomfort does not improve within 5 minutes, or if it comes back repeatedly when you exert yourself or feel stressed, do not wait. Call your doctor the same day. The heart does not have pain receptors the way your skin does. It sends distress signals that your brain misinterprets as digestive discomfort. That is not a mistake. That is how your nervous system is wired. If you feel persistent chest pressure after meals, do not assume it is always food-related. Track when it happens. Note if it occurs during activity. Tell your doctor exactly when and how it feels. Sign number 2, unexplained shortness of breath. Sign number 2 is becoming short of breath during activities that never used to wind you. Walking to the mailbox, climbing 1 flight of stairs, carrying light groceries from the car. If you are regularly stopping to catch your breath during activities that were completely normal for you 6 months ago, your heart may be struggling to pump blood efficiently. When the heart weakens, it cannot push blood through the lungs fast enough. Fluid can begin to build up in the lungs. Every breath becomes more work than it should be. Seniors often blame this on being out of shape, on gaining weight, or simply on getting older. But sudden or worsening shortness of breath, especially at rest, is never something to dismiss. Ask yourself, was I able to do this same activity 3 months ago without stopping? If yes, and now you cannot, tell your doctor at your next appointment. This is exactly the kind of change that catches heart disease early. Sign number 3, jaw, neck, shoulder, or arm pain with no injury. Sign number 3 is pain or discomfort in the jaw, neck, shoulders, or arms, with absolutely no injury or physical reason to explain it. This is called referred pain, and it is one of the most misunderstood signs of heart trouble in seniors. When the heart muscle is not getting enough oxygen, it sends distress signals through the nervous system. But your brain does not always correctly identify where those signals are coming from. Instead of feeling pain in your chest, you feel it in your jaw, which feels like a toothache, or in your left arm, which feels like you slept on it wrong, or in your upper back, which feels like a muscle strain. Seniors visit dentists for heart attacks. They take ibuprofen for shoulder pain that is actually their heart. This happens every single day in America, and this connects directly to sign number 6, which I will show you right after the break, because there is one measurement your doctor takes that predicts whether you are at risk for this kind of silent attack. Most seniors see that number every year and have no idea what it means. Any jaw pain that appears at rest and is not related to eating or dental work, especially if it comes with fatigue, needs same-day medical attention, Do not treat it with painkillers and wait. Sign number 4. Swollen ankles and legs, especially in the evening. Sign number 4, and this one surprises many people, is swollen ankles and legs, particularly as the day goes on. In our kidney video, we explained that swelling can indicate kidney failure. But the heart is an equally important cause, and the two conditions often occur together in seniors over 60. When your heart weakens and cannot pump blood efficiently, blood begins to back up in the veins of your legs. Fluid leaks out of those blood vessels into the surrounding tissue. The result is swelling, particularly in the ankles and lower legs by end of day. The test is the same as what we described for kidneys. Press your finger gently into the skin above your ankle. If it leaves a dent that takes several seconds to refill, that is a warning sign that demands investigation. Is it kidneys? Is it the heart? Is it both? Only a blood test and an echocardiogram can tell you. But the point is, you need to find out. Press your finger above both ankles tonight before bed. Any persistent pitting that does not resolve overnight is a sign to bring to your doctor immediately. Sign number 5. Extreme fatigue that gets worse with light activity. Sign number 5 is extreme fatigue, particularly a type that gets worse when you try to do even light physical activity. In our kidney video, we discussed fatigue from low EPO hormone. Heart-related fatigue feels different. Heart fatigue is a deep exhaustion that worsens the moment you start any physical task. Making the bed, walking to the kitchen, getting dressed. Activities that require almost no effort suddenly feel overwhelming. The reason is this: your weakened heart cannot increase its output fast enough when your muscles demand more oxygen, so your body shuts activity down before it even fully starts. Many seniors describe it as, "I feel okay sitting still, but the moment I try to do something, even something small, I feel like I have run a mile." This is your heart telling you it cannot keep up. Do not ignore it. Track your energy over 2 weeks. If activity-related fatigue is getting noticeably worse, not better, put it in writing and bring it to your next doctor appointment. Ask specifically for a BNP blood test. This directly measures heart strain. Sign number 6. High blood pressure. The sign your doctor never fully explains. And here is sign number 6, the one I told you to wait for. High blood pressure, also called hypertension. I know what you are thinking. Everyone knows about high blood pressure. My doctor checks it every visit. But here is what almost no doctor takes the time to explain. High blood pressure has absolutely no symptoms that you can feel. None. You cannot feel your blood pressure being high. There is no pain, no warning, nothing. Yet sustained high blood pressure silently thickens and hardens the walls of your arteries. It forces your heart to work harder with every single beat. Over years, it damages the heart muscle itself, increases the risk of heart attack and stroke, and destroys the tiny blood vessels in your kidneys and brain. The number your doctor should be telling you is this: if your blood pressure consistently reads above 130/80, you are already in stage 1 hypertension, above 140/90, stage 2. Every point above these numbers is additional pressure being placed on your heart and arteries every single minute of every day. The most dangerous thing about high blood pressure is not the number itself. It is the fact that people feel completely fine and stop taking it seriously. Buy an arm cuff blood pressure monitor for home, available for under $30. Check your blood pressure every morning before eating. If you regularly see readings above 130/80, bring your log to your doctor. This single habit catches more heart disease than almost any other health action you can take. Sign number 7. Cold sweats, nausea, or dizziness without obvious cause. Sign number 7 is breaking out in cold sweats, feeling nauseated, or experiencing sudden unexplained dizziness, especially when these symptoms happen together. Many seniors dismiss this as a stomach bug, or low blood sugar, or the beginning of a cold. But cold sweats combined with nausea and lightheadedness, with no fever and no obvious digestive cause, can be your body's distress response to cardiac emergency. When the heart is struggling to pump enough blood, the body activates its emergency stress response. Adrenaline floods the system. Blood is redirected away from the stomach and toward critical organs. This causes nausea. It causes sweating. It causes the pale, clammy appearance people describe after a heart attack. Women specifically are far more likely to experience heart attacks without chest pain, with nausea, fatigue, and cold sweats as their primary and only symptoms. This is why heart attacks in women are so often missed. If you experience cold sweats with nausea and dizziness at the same time, without fever, and it lasts more than 5 minutes, do not wait. Call 911 or have someone drive you to an emergency room immediately. Sign number 8. Irregular heartbeat or fluttering in the chest. Sign number 8 is an irregular heartbeat, a fluttering, racing, or skipping sensation in your chest. Most people have felt their heart skip a beat occasionally. This is usually harmless. But in seniors over 60, a frequently irregular heartbeat, particularly one that comes with dizziness or fatigue, can indicate a condition called atrial fibrillation. Atrial fibrillation, or AFib, is the most common heart rhythm disorder in adults over 60. It means the upper chambers of your heart are firing chaotically instead of in an organized rhythm. And here is why it is so dangerous. When blood does not pump efficiently through the heart chambers, it can pool and form clots inside the heart itself. Those clots can then travel to the brain and cause a stroke. AFib is responsible for 1 in every 5 strokes in the United States, and many seniors have it without ever knowing. Ask your doctor to check for atrial fibrillation at your next visit. A simple 30-second ECG test can detect it immediately. If your heart regularly feels like it is fluttering or racing for no reason, ask for this test today. It costs nothing and can prevent a stroke. Sign number 9. Confusion, sudden brain fog, or feeling of impending doom. And sign number 9, the final warning sign that almost nobody talks about: sudden confusion, unusual brain fog, a strange, inexplicable feeling that something is terribly wrong, even when you cannot describe exactly what. Doctors call this a feeling of impending doom, and it is more medically significant than it sounds. When the heart begins to fail and blood flow to the brain decreases, the brain sounds its own alarm. Patients describe a sudden and overwhelming sense of anxiety, a certainty that something serious is happening, even before any physical pain appears. Confusion and sudden mental fog in a senior who was sharp moments before is a medical emergency. It can indicate that blood and oxygen are not reaching the brain in sufficient supply. If you or someone near you suddenly seems confused, disoriented, or unusually anxious with no clear reason, combined with any other sign from this list, call 911 immediately. Do not wait to see if it passes. Trust your body. If you feel something is seriously wrong, even if you cannot explain it, act on that feeling. More lives are saved by seniors who acted on a subtle warning than by those who waited for dramatic symptoms. Here is exactly what you need to do starting today. Number 1. Buy a home blood pressure monitor. Check every morning before eating. Write the numbers down. If you consistently see readings above 130/80, call your doctor this week. Number 2. Tonight, check your ankles. Press your finger above each ankle bone. Any pitting that holds, write it down and monitor it daily. Number 3. For the next 2 weeks, track your energy and your breathing. Are you becoming more winded on activities that were normal before? Write it down. Bring it to your doctor. Number 4. If you experience any combination of jaw pain, cold sweats, nausea, and dizziness, even mildly, do not wait. Seek medical care the same day. Number 5. At your next annual physical, ask specifically for 3 tests: a BNP blood test to measure heart strain, an EKG to check your heart rhythm, and a fasting lipid panel to check your cholesterol. All 3 are covered by Medicare, and all 3 can catch heart disease before it becomes a crisis. You cannot feel most of what is happening inside your heart, but you can feel the warning signs. If you know what to look for, you now know what to look for. If you missed our previous videos, link to the kidney warning signs video and the 7 liver foods video are right here. Watch both of them. The heart, kidneys, and liver work as a system, and protecting all 3 together is how seniors live long, strong, healthy lives. Next week, the number 1 vitamin most seniors over 60 are dangerously deficient in right now. It is not vitamin C, it is not iron, and your doctor has almost certainly never tested you for it. Subscribe so you do not miss it. Stay healthy. I will see you in the next video.